Good morning, everyone, and welcome to AI for Innovation web series by AWS and T-Hub. Um, and the focus of this web series is to uh, uh, tell you about importance of AI and let you know what are entrepreneurs and AI experts have their point of view on how you can leverage AI to build up your product and services and take your business to and your innovation idea to next level. A few one major housekeeping rule since it's a webinar. You can post your question on the Q&A. Amitabh, I'll assign the question to Amitabh so he can pick up them and at the end of the panel. And you can also raise your hand. Then we can allow selected few to speak up their questions. And without delaying any further, over to Amitabh.
Hey, thanks, sir. I'll just start with introducing why healthcare and why AI in health, and then I'll also introduce Ankit and Ajit, who are two leading entrepreneurs in the healthcare space, whose wisdom and mentorship and advice will definitely help all our listeners who are also thinking about building healthcare companies leveraging AI. So if you look at why entrepreneurship in healthcare is extremely important is that in India we are dealing with 1.3 billion people, and to serve the needs of a healthcare infrastructure to cater to their needs of doctors, hospitals is a pretty impossible task. Fine. Now, today what has happened is there is an evolution in technology in terms of sensors which are on your phone. So your phone is nothing but a medical device with sensors. There is internet. There is an ability to connect from one place to the other. So that just creates a very different mechanism of a healthcare infrastructure, which can help the hospitals. Um, Fine, and patients can be connected with doctors. Engagements can happen real time. Your point of diagnostics is happening now at the point of care rather than at labs. Fine. So we have more data generated. We have our ability to engage patients is becoming very remote. Fine. So all that we are at a very interesting cusp, which is created by the evolution of technology and the need that actually spurring this innovation. Fine. So if you look at the amount of capital that has come in healthcare, and the number of startups in the last 6 months or 1 year has been three times what the last few years have been. Fine. And with that, what I'll do is I will, like to introduce the two panelists, Ankit and Ajit, and I'll have to call them and tell them to share their stories before we actually start asking them a few questions. Hey, Ankit, I'd love to hear from you. You build this beautiful business of your innovator. Fine. If you could just introduce yourself, tell what you do, and then I'll request Ajit to follow that same.
Sure, Amitabh. Thank you so much. Hey, everybody. This is Ankit Maheshwari. I'm the President Engineering and India Operations at Innovator. So at Innovator, what we deal with is majorly US healthcare is whom we are working with and trying to solve what Ajit Amitabh, very well mentioned is the data problem, right? In India, we are seeing it right now when these digital tools and solutions are coming in and data is starting to get generated and consolidated. In developed economies like US, that data has been there for now around 8 to 10 years, right? And still the doctors and the clinicians have not been able to make much sense out of it because it's so distributed. So what Innovator does over there is getting all that technology to make sense for these providers, for the patients, for the payers and everybody involved in this care journey, what we call the circle of care, and make it care as one, making that data sense, analyzing on top of it, giving insights to the provider at point of care, behind the scenes to the payer provider and also to the patients, so that how you can help them in preventive care, how you can help them personalize their care journey to have more effective care and basically reduce the cost of care and also make a difference in the how the care is provided to them. Yeah, Mamita.
Thanks, Ankit. And so how long has it been in your journey from your time that you started this to where you are today?
Yeah, in healthcare, so we started off around 7 years ago, but in healthcare, it's been 5 years for us now.
Oh, thanks a lot. That's great. Here, Jeet, I love to hear what you guys are doing. You're solving a real Indian infrastructure problem in healthcare. If you could
Sure.
share your startup journey with the people in the panel right now.
Right. Thanks, Amitabh, and good morning, everybody. So my name is Ajit. I'm the CTO and one of the founding members of a healthcare startup called MFine. We are based out of Bangalore. So MFine was formed in 2017, primarily looking at the primary and secondary healthcare delivery problem of India. Right. We saw two main problems with it. One of that being of access. I think all of us here in this group would know the abysmal number of doctors to patient ratio that always is being talked about. The problem multiplies itself when you talk about super specialities and specialities. So access to healthcare remains a big challenge for most of India. Right? We know that if you leave the tier one, tier two cities, you can pretty much say that there is no access at all. So that was problem number one that we looked at.
I think we lost.
I believe Ajit
Yeah,
is.
Jeet, I think we've lost Ajit. Hey, Ankit, can you hear us?
Yeah, I can hear you.
Becomes a big question. So quality suffers, right? Quality is a big problem. Outcomes cannot be promised. That becomes a second challenge, right? There is no digitization. There is quite a bit of self-medication that happens in the country, and so on. Add to this, I think we all know that India is slowly becoming the non-communicable disease capital of the world. There are more cancer patients and diabetes patients getting added every year than any other place in the world. So I think the crumbling infrastructure adds to the problem quite dramatically, and that is what we are out to solve. We do that by using two fundamental pieces of technology. We believe that this problem cannot be solved in a traditional way, by the way, right? It's not like we can train more doctors and produce more doctors over the next few years. We are 500,000 doctors short by 2030 by any conservative estimate. So it needs a technology solution. And the technology solution comes from two aspects. One being mobile and mobile internet. So if you virtualize healthcare to the degree possible, Amitabh talked about mobile devices as being the new examination tool, the new stethoscope, as we call it, could be potentially a way in which we can address some of these problems. Uh, if you virtualize healthcare and if you allow the power of the mobile devices to act as one of the devices for the doctors, you can make healthcare accessible from any corner of the country. Anybody could access it. That is the first solution. Second is we use AI extensively because we understand that the quality problem can be solved by making the doctor extremely efficient in what he is doing, so that he is able to see more number of patients. So that way you address the sort of the disparity problem, but also you can evolve the right protocols required for a certain disease and care. If I know that a certain care plan is working for a kind of a patient profile from a good doctor, the machine should be able to replicate that for every other doctor as well, right? So that's the way we use core of the technology, and that is what we are here doing at MFine, really trying to solve the problem that we want to give every Indian an access to a top doctor, and that's what we do.
Thanks, Ajit. That's really good. And all this becomes really, really important if you look at it. As you said, that specifically in India, we are dealing with one of the most something not to be very proud of, that 100 million people have chronic conditions. Fine, and we need to put that into an economic construct also. And what that actually means is that if few people have diabetes and they look at the long-term cost and implications of diabetes, the cost implications of diabetes are so huge in terms of productivity loss to the nation, in terms of cost of dialysis, cost of neuropathy, fine. So pretty much you're looking at, and medical costs are one single lever actually that is also about making economically people poor, fine. They fall off an economic stratification. And if you actually look at it, globally it is happening, and even in India, we are actually now pretty much in that same economic structure is where healthcare inflation costs are much higher than normal inflation costs, fine. So we really have to think about how do we decrease the healthcare burden? How do we actually, with the less doctors, get into a preventive first infrastructure? How are we able to, similarly as to what Ankit is doing in terms of making sure the data is movable between doctors, payers, providers, that itself is available in India, and we can actually at very early insights reduce cost of care. Fine. So thanks a lot, Ankit and Ajit, for laying the foundation. We'll start with some questions, fine. In terms, if you look at it, fine, we talk about the penetration of technology in the clinic, fine. Post COVID, what have you seen specifically from Ajit, fine? That how has been the adoption of technology? What has happened? That there are positive tailwinds that have resulted into adoption of technology. Has there been government support? Has there been standards? Fine, because without standards you will never be able to get the data together. And Ankit can talk later about more about what can we learn from the US market, that some things can happen in India and we can reduce the time. Fine. So Ajit, first is yours, and then Ankit, then you can help what your learning has been, how we can drive that in India.
Right, right. So I think the straight answer for that is yes, it has helped. And I'll just lay a foundation of how and why we can look at it very positively. Although I mean, pandemic itself has to be viewed with a very different lens. What we lacked in a physical infrastructure and the lack of very qualified doctors spread across the geography, etc. I think India made it up with having a pretty decent digital infrastructure in terms of mobile internet and data, right? I think we are one of the cheapest per gigabyte cost of data in the world today. So I think we always had a strong technology, or let's say data and internet foundation in the country, thanks to penetration of e-commerce and internet prior already, right? So that was the state before. Digitization in many other sectors have already started to happen, and I think consumers are used to here and now on demand, let's say, access to things, right? Be it food, e-commerce, whatever is in it, travel, all of that. So we come from that kind of a background. Now, where we suffered really in terms of healthcare is the infrastructure pieces, right? Meaning adoption of technology by both doctors at hospitals, data being seen as something that is owned by patient and to be shared between providers for better care. All of this did not exist at all. I mean, even if some amount of digital data existed, it was in silos here and there, not very clean, all of that, right? So we suffered a little bit with, I would say, digital adoption in healthcare. And of course, I think as a consumer and doctor as well, the openness to use technology very core, I think, did not exist in this industry, at least the way we saw it. In 2017, we started it, and it was a bit of a push that we had to do early on, etc. There at the same time, and there are also consumers and doctors who are very savvy with technology and who get onto this boat very quickly. What the pandemic has helped is in the following way. I think one, out of sheer necessity, I think a digital first approach to consultation started, right? If you look at examples, the telemedicine sort of guidelines that the government has been, I would say, go out on a limb and say, has been sitting on for years, got approved and rolled out in weeks' time, right? In a couple of weeks, right? So it really accelerated some of this. I think it pulled it back by maybe a few years very easily. Policymakers were at it very quickly. Really, the government, and I should really bring it out, I think the government really saw that technology can be the player in actually helping the situation in COVID, right? I think a lot of work from Niti Aayog and the NHA, etc., um, to really focus, talk to a lot of startups, talk to a lot of technology companies, and see what infrastructure we can put together at a very fast pace to make sure that in the eventuality that the COVID really goes down south in terms of massive hospitalization and everything else, I think we had the necessary support from the government to move forward. So I think policy making definitely has changed. The adoption and the mindset in people, both in policymakers, consumers, and doctors, there is a newfound belief that yes, this is actually doable. And the fact that we actually managed this pandemic time with lockdowns, very strict lockdowns, and healthcare still did move forward, I think lays a path forward, right? Third, I think the National Digital Health Blueprint, which is also something that was running in the background for years, etc., suddenly has seen a new lease of life. Very quickly, the DigiDoctor, the registry for doctors and facilities, etc., have come into fast track. You've seen the consent management system for data exchange between patients, providers, being fast tracked. That has been now, it's part of the NDHM rollout. They've rolled out a sandbox. People can actually sign up into it. The NDHM consent manager gateway is live. Swasth as a foundation came about, which came together with various healthcare startups to do something for the government. So all of this has, I think, massively given the tailwind that this industry required. And from MFIN as well, we are seeing that happen as well. I think there is more and more doctors and hospitals getting onto this bandwagon very, very fast now. Consumers are seeing this as actually a very tangible, very, I would say, smooth way of accessing healthcare. So that has definitely shifted. I would say the baseline of thinking. I think easily this has been, to me, this is almost like the demonetization change that happened for payments. I think in some sense, in a bad way, right? Pandemic, I mean, nobody wishes for it, but has helped. And I think this will help India leapfrog some of the countries in the West actually and truly become a digital healthcare nation, I believe. And I think I am, fingers crossed that this is a huge moment for, I think, India as a whole, and we can turn around the way we approach healthcare, way we deliver healthcare, and way I think we can turn India into a healthy nation as opposed to be unhealthy as of today.
That's great, Ajit. And I just think that's very well said, fine. And I think that's a great way for us getting Ankit into the call, because he's looked at the infrastructure in the US, fine, and I've seen healthcare infrastructure both sides. Given the maturity of the healthcare infrastructure that exists there, what are his learnings there? What are his learnings? How can India just move the needle very fast in terms of adoption? And what would he like to, what would his suggestions for India be, given that he's been in one of the most mature markets of healthcare and he's been working there for some time? Hey, Ankit.
Sure. I think a few great points what Ajit mentioned out, right? The push from COVID, like, not only happened in India, but even in US, right? Like COVID made the biggest push to at least leapfrog the adoption of the technology. The technology had always been there. Like virtual care was not new for US, but still the doctor, the providers are not going on to it because just the cost difference and the regulations were like in India, even pending over there, like how much do you get paid if you do a virtual consult rather than a visit consult over there. But that all changed because of COVID, like at least a 5-year push over there, like the adoption of virtual care, e-consult, all these increased tremendously, right? And one thing which they already had was, okay, the interoperability standard. I think that is the key, like what even Ajit was talking about, right? If you go onto an online platform, right, there are multiple, even in India, like even when I open my phone, there's MFIN, there's Practo, there's so many other, like if I go to different doctors, how do they share data? How does that come together for even my insurer or for my provider or even for me, right? That is the biggest hurdle that comes, and that is what happened in US. And everything got digitized like 8 years ago with Obamacare coming in. But what halted the progress was the interoperability standard, right? And took them, it still taking them time, right, with government push and CMS and everybody to come to a common standard so that everybody can share data. And I think that is something which once the policies are getting implemented in India, right, having that common interoperability standard between all the healthcare organizations, and it's great. Like because most of the healthcare organizations coming up in India are startups and they're open to technologies, are not a big mammoth shop who want to conserve data just to themselves. They are much more open in culture wise, right? Because these are young startups. They believe that, okay, sharing it up will benefit each and everybody of us. So if we move in that direction, where like now with like say, and I've seen that like HL7, that kind of adoption and thing that are happening in India is great. Like in India is always famous for leapfrogging one technology jump over the West, right? So missing all the bad ones, like be it CCD HL7, moving directly maybe to Fire R4 or the latest standards of interoperability, right? Will be, I think, some major piece which will help take whatever is happening in India to the next level and actually beat the West in that thing, right? Because yes, like Ajit said, we have the power of accessibility because internet being cheap, mobile, everybody having the smartphone in their hand, accessibility is there. Everybody has that access to those applications. If we are able to key and track and basically hit on the interoperability aspects, and then will come basically how using that interoperability we are able to create much more personalized and a circle of care, right? Because it's not just the provider who's providing the care, right? Having those custom care plans, having those like in which I have seen in US, like this whole culture of health coaches and community workers who come and create a circle of care, so that it's not only the provider who's providing the care, it's the family members of the patient as well, giving them the right insight that how do you, and we have seen that happen in COVID, like when you are doing a home quarantine, it is the family who is caring for you, right? So how it happens can happen for other diseases as well. We talked about diabetes, right? Prevent or say breast cancer, how prevention can be the key thing to cut down the cost of care and actually impact the lives of individual, is going to be a major chunk of thing that you can do. How do you put all these measures, these preventive measures with the providers? How do we incentivize them? US did it very well with the payers and the government in incentivizing the providers to be that active, to do all those preventive tests and basically cut down the cost of care, because 85% of their population is on insurance. How will that happen in India? Who will make that push is going to be very important, right? Because otherwise the provider will have to make that effort over there to keep those things in check, right? How do it's do that preventive measuring every time a patient comes in, and how do they get incentivized for not only for the value based care concept, basically that you get incentivized not just for the service that you are offering, but also the value that you are creating in a patient's life. I think that aspect will be key.
Absolutely, Ankit. And I think what you refer to is that in India is still a little early, and I think that's where the opportunities will be, because frankly speaking, the payer provider network has not been created in that manner. Fine. So here, actually, most of us as individuals are payers. Fine. And the provider is the hospital, and the incentive for creating value-based care, circle of care, that your care is very well, actually sadly lies with the payer, and that is us. And as individuals cannot be very big economic buyers of services and opportunities or software products, I think that creates a very it creates kind of a very difficult environment for who will buy the service which is needed, right? And I think as the insurance carrier is growing and insurance is becoming is increasing, you will have the insurance providers coming in and playing a very important part in saying that these solutions are necessary. And so hence for the budding entrepreneurs there, it's very important for you to look at global, what are the gaps, what happened there in 30 years will definitely, concepts like care plan, concepts like circle of care, concepts to manage continuous care, where the care is not only given by a single doctor, but by a group of coaches, nurses, family members will be needed in India. And I think that those are the places where we will definitely see a ton of opportunities that will get created in India. Yeah. With that, you've talked about, Ankit, you talked about reducing cost of care by looking at data and personalization. Fine. How have you seen personalization and personalizing care plans, personalizing, reducing the overall the treatment cost? Fine. Because it's very counterintuitive that if I actually say I'm going to personalize treatment for everybody, fine, that means I'm going to spend more cost. But actually, it's very counterintuitive, fine, because personalization reduces the healthcare cost, fine. So, I'd love to hear your thoughts there, Ankit, on how are you doing, or you think India can help and benefit from personalization.
Sure. And I think first we need to understand like what does personalization even mean, like when we talk about a healthcare concept, right? Is it similar to say when you go to a gym and you have a personal trainer who is very much focused just on you, creates a very individual maybe a diet plan, a workout plan for you to affect your health? Or if you go to wider industries, like, and I will take a very parallel, like a Spotify, right, who does personalization based on your taste and gives you music to get you a better experience, right? Because it puts you in a cohort. Okay, you have these kind of demographics, you listen to these kind of music, so this is the kind of blog that you fall in, and maybe you will like the similar kind of music what the other person in your cohort likes. So in healthcare, that is one of the easiest and basically most effective and high impact way of doing personalization, where based on analytics, based on seeing the pattern, you talked about multiple chronic conditions, like what the clinical history of that patient has been, what the social history of that patient has been, what where the demographics, there's a very clinical term like the social determinants of health, right? Where you live, in what demographics you live, also determine a lot about your health, right? Put Aligning all those different data points to come to a cohort in the population health space. Okay, this is the population cohort which is very similar, and then learning from how previous patients have been treated and what care plans and care journeys have worked from them, and applying them there gives a very big head start for the clinician on health coaches on personalizing an effect, and basically that reduces the cost, because if you are preventing multiple chronic conditions to develop in a patient, there's a huge cost saving over there. Over there, even if you know, okay, if the patient is single, female, more than 60 years living alone, and you just make them a weekly call for them to refill their medication, right? Learning from, okay, because learning that in previous patient that has been a major cause, like people miss their medication and then fall sick, and you are just learning from that pattern and making just a simple call to remind them that, hey, you need to refill your medication or take those medication on time or go for a walk twice a day, just reduces the chance of basically deteriorating their health. So these kind of personalized care plans hugely impact how patients are behaving and the cost of care in general. And these like, and that's what I'm saying, it's not like one to one, but finding that population cohort over there and personalizing your care plans and care journeys accordingly is what will give impact. Then you move to the second piece, like when you come to the provider level, then yes, you have a lower cohort to manage, you have less patient, and that is when the patient side of the care journey comes into place, where they're having an application on their hand, and they sending data to their provider at the point of care, and they getting more and more details from your health watches, or just you feeding and how you are feeling today, or did you miss your diet, and then care managers or health coaches sitting over there personalizing based on the feedback that they're getting from you. I think these two things is what I've seen like has put a huge impact in decreasing the cost of care at all the customers that we are working in.
Excellent. Okay. And Ajit, you are using a lot of AI for personalizing care plans and all, fine. So how are you leveraging it? How do you think that's going to impact the cost of care? Fine. So love to hear your thoughts.
Sure. So for us, largely our AI plays. I wouldn't call it personalization yet. We are not, I would say, on the journey yet so far. Where we employ AI is to actually to make sure that the disparity of the doctor and patient is somehow managed. And the reason why we have to do that is the following. We believe that there is a way to replicate good care, right? I mean, if a good doctor can be made great, and his care and his practices should be replicated and given to as many number of people as possible. And today, that is not possible either because of geographical problem or because of the time that he has to spend. Right? There's only limited time that every doctor has, and therefore you can only see so many patients and so on. So our AI tries to learn that from the doctor to scale his time and scale him to become a super doctor. That's how we sort of call it. So which means our AI starts with understanding basically the you can say the medical domain. It has base understanding of basic reasoning, saying, look, I can find out root causes given symptoms. I'm able to find out a differential diagnosis, and from there use different modalities and arrive at the differential diagnosis, and from there I can arrive at a treatment plan. But I know it generically. It's just like an MBBS doctor, if you will. Right? When you start off, there are some things that you learn from a bookish knowledge point of view. Then you study each of the doctors. Let's say there is a great pulmonologist and he's looking at care in a certain way. There is a great diabetologist or endocrinologist who's looking at pre-diabetes care in a certain way. Then you study each of those interactions, right? The machine picks up nuances and features from every interaction that happens between him and the patient. And then it starts to become intelligent in understanding that, okay, if somebody come with pre-diabetes, this is the care that this doctor gives. And I've seen outcomes based on the patient's response that it has actually worked. So therefore, I know this care plan works for this kind of a patient profile, right? And you apply that now to every other doctor and every other you can say the same doctor with multiple patients or with multiple doctors, you can apply the same algorithm, right? So this way, you sort of learn and mimic what the doctor does. In some sense, it becomes the virtual avatar of you inside the system. Now imagine how this can scale. So I don't need to study the longitudinal history, ask you questions and do all of that and spend my time as a doctor. I can let my virtual avatar do that on my behalf and collect all this information. So which means now instead of seeing one patient in a time, we share the same time, right? We are in a conversation here and both of us spend this equal amount of time. Now, if I were to make this asynchronous, I can do this same protocol across hundreds and thousands of patients at the same time, and then make sure that the right approaches are given to the patient. So which means that I now, as a doctor, scale quite non-linearly with respect to my time, giving that care to as many number of patients as possible, right? And that's how you do this supply and demand problem that healthcare essentially is there in the country today. So that's the way we employ AI at the core. So which means that we are able to look back into longitudinal data of the patient for a very long time. We are able to look at his diagnostic reports, pathology or radiology, understand nuances from there and construct what it means for the doctor so that he can actually summarized view of the patient in a very simple form he can view and he can make the right calls, right? And that's supremely efficient for the doctor and also for the patient because, well, he doesn't have to carry about all these documents running from doctor to doctor, all of that. For him, getting a second opinion from somebody else is as good as just clicking another button on the app and so on and so forth, right? So it benefits both sides. So that's the way we employ core AI. Parts of this, we will do this as part of self, let's say, awareness tools for patients. If you really look at today, there is a lot of awareness also missing in terms of how to approach healthcare, right? We talk about non-communicable diseases to be sort of lifestyle diseases. But what is it that I have to do to understand whether I'm predisposed to something, or if I'm in the early stages of something, can I make adjustments to my lifestyle to make sure that it is in control, etc. I mean, there is a way to also self sort of understand this and get a view of this awareness. So this will come in form of very simple AI-driven, let's say, I would say what we call as checkers and trackers. We call it that. I can simply assess whether I am currently undergoing some amount of depression because I'm sitting locked up in my house for the last 6 months, right? Do I have any anxiety problems, right? Being aware of things. I'm just giving you examples of psychiatry, but um, you can just get yourself just into the healthcare journey by simple awareness tools, which is also powered by AI. And lastly, it goes into preventive care. If somebody is made aware of what it means to be pre-diabetic, what are the telltale signs, and on so on and so forth, you can also get into the journey of preventive care, saying that it doesn't harm anybody to do a health check once in a year. In fact, it is absolutely great if everybody does it. And by looking at and getting expert opinion from a doctor after the health check is done, you are already in the journey of making sure that your lifestyle is managed, your parameters are in control, and so on and so forth. So that when you are 40 plus, 45 plus, or 50 plus, you don't have to necessarily end up in a hospital. Right? Stay out of the hospital is actually the right way of looking at application of AI and being healthy overall. And that's the way we are doing it. Yes, you can call it personalization, because in the end, the treatment plan is personalized to your parameters and what you come with as your health profile. But that we use it largely in the way to help doctors, assistive technology to doctors, that they're able to give you the right suggestions for you to lead a healthy lifestyle, right? So that's the way we are using AI. Amitabh, you're on mute.
All of us are very individual patients, fine, and we have our own behavioral characteristics. And even for if you're a diabetic, you are not the same diabetic, fine. You might have a high and low, early in the morning or late in the night, and hence the treatment pathways, the care pathways,
Yes.
all change. And the more you personalize, what happens is the effective treatment pathways happen.
Absolutely.
And you are able to cure if you're able to cure faster, etc. And that's also is a cost saving.
Absolutely.
So Ankit, yeah, as you've been seeing the healthcare for 5 years, and you've seen the US, and we've got many young entrepreneurs listening to you. What would you say are the top 2-3 areas in terms of tech, or in terms of ideas that they should look at from an India perspective, or even from a global perspective, that these are the new opportunities happening, that it gives them kind of a thought process as to how they look at the problem, fine, and how can they define the problem better, and how they have clarity on the problems that they are solving.
Sure. Yeah. So I think, like I said, like one of the key things which I feel like, as the India market is booming up with all these interoperability, definitely is going to be one, right? Specifically for the India market, because right now it is very untapped. Because right now it's just the application, like what happened in the US in 2010 or 12, when a lot of EMR companies started to come up, right? So everybody started digitizing the data, right? Similarly, that is happening with right now in India. There are not so many EMR vendors, but all these virtual care solutions are kind of doing that, digitizing the data, because your data getting stored. So how will we make them interoperable, and organizations and companies more on the data and the analytics piece will definitely be something. So either these organizations will need to have those wings over there, or there will need to be a common, what we call the healthcare exchanges, basically, right? Is going to be one major idea that is going to definitely be needed in India, right? Also, like, apart from the big US and international players coming in India with their EMR solution, I really feel there is a very big need over there, like where we have a homegrown EMR solutions as well, right? Who cater to specifically the demographic of India, like how Indian doctors work, because it's very different from how like US doctors work. They have a very different workflow altogether. So rather than customizing those global EMRs, building homegrown EMRs is something, again, when I say EMR, the electronic medical records, basically the tools that the providers are going to use. Like online care and mobile is fine, but once people start going and visiting the clinic, still there is no common tool where they can store the data, have those transcripts over there, and basically have those things stored for later use, and to be given to these digital health companies to work on top of it. I think we are doing great on virtual care. So these two things, I feel, and then the third will be basically the provider patient relationship, which we already have started with all these different apps, but taking it a step further where you are integrating multiple solutions to it to give a more holistic care. I think building like a platform, right, where you don't only have the like the provider can send a lot more than just do virtual care, can give them post care solutions. Okay, you can have different applications like say post they have given us, okay, like connecting them to maybe some community workers or a physiotherapist who can help them post the treatment. Those kind of marketplace or basically kind of platforms will, I think, will be the third piece which will revolutionize or basically will be very much needed.
Thanks a lot. Okay. Hey, Ajit, what are your what do you think is the roadmap for Indian entrepreneurs to define opportunities? What are your suggestions? How should they look at?
Yep. So I think from an India perspective, I think the problem space is pretty massive. I think if you purely look at just digitization across healthcare, and I'm talking purely from a primary secondary care. Healthcare, of course, is a wide domain. I mean, everything from drug discovery to genetics is included there. I'm not talking about those, but purely from a digitization of making health digital. I think there is immense scope for a lot of players in this market. Just give an example. I mean, there are even for players who do purely personal health records for patients, because it's going to be patient centric going forward. Very clearly, from the way it has been defined in the NDHM and where the whole overall direction of this industry is moving, it is going in the direction. So starting from there to hospital systems for EMR, like Ankit mentioned, digital decision support systems for doctors. All of this, I think there is enough and more scope. If you look at pharmacy, e-pharmacy, the larger picture would be taking care to the point of care where care is required. I think today it is somewhat in a walled garden of a hospital and a clinic. I mean, it is sitting there. How to distribute that and bring it closer to the patient, I think there is immense opportunities. Look at the way devices are coming up, the way, if you look at IoT devices and the kind of innovation that's going on in that space, it's just mind-blowing what can be done. I think barring, very complicated imagery, rest of it, I think, will move more to your wearables and your devices. There's immense scope there as well for a lot of entrepreneurs to come and innovate. There are so many startups today. When you look at that do some amazing work. I've recently come across a startup that we've been talking to, who are detecting your arrhythmia and heart problems purely by having a small sheet underneath your bed, and they're looking at mechanical vibrations that emanate from your breathing and your heart and things like that. Amazing stuff coming. Imagine this coming out of India, and I think there is more and more scope to take care from the deep ICUs and the hospitals of the world to where patients need it. I think that is the scope, and that's the direction we can move in. And I think that would be my my 2 cents on it. And I think finding the right sweet spot in terms of the consumer problem would be what people should look at to build some amazing products.
And what do you think is the main bottleneck on building kind of a health exchange platform in India? Fine, Ankit talked about it, that we should build it. I don't, it's a simple thing to say, to build it, but I'm very sure that there's going to be friction. Who's going to own it? Who's going to be
Correct.
the architect of it? Fine. So if you look at India, who's building it, and then we can go back to Ankit. Who does Ankit think is building the best health exchange platform in US? Fine. So what have you seen, Ajit? What are the friction blocks? What would you suggest, say, NITI Aayog or the National Health Data Exchange? to actually build it? Who would own it? How would that go about?
Right. So I think today Ankit talked about interoperability in the US. I think we are in India. We are still talking about quasi interoperability. We're not talking about standards yet, but at least the fact that you can exchange documents. I think we are starting from there, right? Which I think is already a good step, great step actually, right? That I can share prescriptions or reports from from one provider, one doctor to another doctor, because it is in effect reflection of what my health parameters are. So the fundamental thing that this whole data exchange relies on is that the owner of the data is the patient and not the providers. And I think that's the root of, for I think all of us providers to understand that fundamentally. It will take us a while to get accustomed to the fact, because traditionally that is not the way it is being done in the country. Everybody believe they own the data, but the reality of the fact is that the raw data of the patient belongs to the patient. It is his. I think that is the fundamental of this data exchange platform, by the way. It belongs to the patient. And as a provider, if you want to participate in the ecosystem, you are bound by the rules of the ecosystem, which is basically you have to share this information when somebody asks for it, provided the user has given consent for it. I think it's a very simple logic they've applied, much like your financial transaction. There's a very simplistic way of looking at it. Money belongs to you. You have a bank, and you decide whether you accept a payment request from somebody or you want to give this money to somebody else, right? I mean, it is in the end, UPI is built exactly on this fundamental principle, and that's the way they're planning to do it also with health, and the foundations have been laid for it. So which means that today, if you do a consultation, or if you with a doctor on, let's say, on a platform X, and you went and got done a radiology test or a diagnostic test in some lab, and it is sitting there, and if you want to now consult a third doctor for an opinion, these two providers are obliged to give that data if the patient says, I want this data to go to the doctor, right? So the patient is in the center. He controls where data moves and how it moves. He decides it, and the providers are obliged to do it. Now, for you to participate in this ecosystem, you can of course sit outside of it and say, I don't care about it, but the whole ecosystem will start moving towards it because of the government push. And I think, and a lot of us startups have already signed up to this, saying that I think this is a great move, right? Of course, you can take the data and analyze it and run your own algorithms on top of it, etc. There is provision for that by the government and the data protection laws. That belongs to you, obviously, because you're running your algorithms and your power on top of it. But raw data belongs to the patient, and he is free to distribute it. And that's the key. If you build on that, I think there is a good chance that we can build it right. The starting points are all good. The involvement and the OKs from the providers that I've seen so far are also very encouraging from that point of view. I think the second step is the interoperability. Oh, what is the language we speak if I'm interacting, right? When I say diabetes, do you understand it as a diabetes, right? Which is the problem that Ankit is facing in US about interop standards and HL7, etc. I think we'll come to that as step 2, but I think this is the way I'm seeing it.
And Ankit, what are your, how do you look at that? Who should help build this infrastructure? Fine. So if you look at US, fine, the US mandated standards, fine, that, and now there's adoption of FHIR. But we've also seen companies like Apple coming and creating Apple Healthcare Kit, which is actually a phenomenal which is a telecom device participating as an exchange, fine. So how do you see the learnings from there and say, you know what, here it's better that a government comes and creates an health exchange and then everybody integrates into that, or somebody like a Reliance Jio or an Airtel comes and creates this FHIR equivalent and then integrates that into the top EMRs or EHRs, like what Apple's done?
Yeah, I think both things need to happen. Even in US, both things happen simultaneously. Like even when you see Apple, when they came in, it's not that they brought in their own standard. They build it on smart on FHIR, right? Yeah. So they leverage the same. And that is what the CMS has defined for everybody to basically adhere to. So, and even like the older HIs that you see in US were all like government and not-for-profit organization. right? And that was one of the reasons like they started going out of profit because not enough funding started to coming, and then private players started to come in and basically said, okay, uh, everybody give us data and we will put it in like kind of an escrow account. I will say that it's your data, it's all completely secure, but if anybody is authorized to see your data, like it is patient data, if they give consent, then only it goes over there, and only providers that are working on you get access to it, but they can get access to all data, and then basically all the participating organizations get leveraged. And then is when these private players like Apple Health or Google Health, like they come in and they also work on the same standard. So the standard needs to be, I feel, is the first thing to get defined, because and that is what even we have learned in US and all other developed healthcare markets, that if you get late in defining standard, it's just too late, because it's too late to work backward and start basically rewiring your technology and your systems over there. It has to be set from the word go. If And that is what my advice to all the entrepreneurs who are going to build things right now or build applications on top of it which deal with healthcare. Choose like if like, and we have been on this discussion even with the government, like we started working with the government of Goa, like even pre-COVID, and then during COVID we developed the first application for that the AI assisted bot to help diverge you can say the COVID situation. Like the standard, like the fire, if fire R4 is what is the latest thing, start learning about those smart on fire and start building on top of it. Because rather than creating your own standard, and it's even easier, like why put a lot of as technologists, like build a lot of brain power in, okay, what my architecture, what my data model, and what all things need to be, if there's already a common standard that's living out there, right? Because if that comes in, it will be easier for you and it will be easier for everybody to share data. I think that needs to be further the government pushing for a common standard for everybody to adhere, so that the new EMR that are coming up, the new technologies and basically apps that are coming up, start adhering to that over there, so that later whenever either the government pushes for the HIEs or there are private people that come up and start setting up HIEs, it will be an equal playground for everybody, right?
That's very well defined. Okay, and I think that gives food for thought for all our budding entrepreneurs sitting here. That this is a big opportunity where we are looking at point of care devices coming in, where where, like what Ajit said, the phone is going to be a stethoscope. It can do it can look at blood pressure. It can look at heart arrhythmia. It can look at many things. And then the other problem is where we definitely need to get one common view of a patient. The doctors have to have a circle of care, and patients' engagement to be managing their care has to become much better. Fine. So we are at a tipping point in healthcare, where technology is coming in, the government spending in, the cost of healthcare going on, and all of us want to get into a preventive first world. Fine. And with that, I would like to thank Ajit and Ankit for a wonderful session. Really enjoyed talking to you both. I've learned a lot myself with this, and I'm very sure the entire group of budding entrepreneurs that we have, who are going to create the next healthcare companies using tech and AI, have learned a lot from listening to you. Thanks a lot. Thanks a lot, Ajit and Ankit. With that, I'll sign off.
Thanks, Amitabh. Thanks for
Thank
having
you.
us.
Uh, Thank you, Amitabh, Ankit, and Ajit, for the wonderful session. I'd request all the participants that as soon as our webinar ends, you'll get a mail from us. This will contain a survey link and also a link to AWS deep dive form. So a deep dive initiative by AWS focuses on giving all the participants of this webinar hands-on mentoring session for in their quest of developing their product further. So I'd like to request all of you to take advantage of that. All of the startups are using AWS Cloud Credits and other AWS mentoring service, and they are getting lots of benefits from it. So thank you and have a nice day to everyone.